So let's move on to a different disease, AML. And paradigm study was also sparked a lot of interest because it has, and I think it was one of the most communicated in social media. Right after it was presented, everybody was posting these results because it has a huge potential for changing the practice in these patients. So this is a paradigm phase 2 randomized multi-center study in newly diagnosed fit AML patients. And these patients were usually treated with a very intensive regimen, chemo regimen, that had a lot of toxicities, obviously. The patients were randomized between two arms. The first arm the patients in the first arm were treated with azacitidine venetoclax combination, and the second arm were treated with the standard of care treatment, which is an intensive chemo 7+3 or CPX-351 as per protocol described. The key efficacy findings, basically they looked at event-free survival and overall response rates. And the 12 months event-free survival and complete response rates were significantly higher in the azacitidine venetoclax arm versus standard of care chemo induction. The overall response rates were basically in the high 80% for the azacitidine venetoclax group, as compared with 60% in the chemo standard of care group. As well, another very important finding was the patients that were treated with the azacitidine venetoclax proceeded to they had a higher rate of eligibility for allo HSCT, so for transplant, basically allogeneic transplant, with similar or better post-transplant results. As well, there was also lower induction mortality and less time in hospital in the azacitidine venetoclax group compared to the intensive chemo group. So the conclusion of this study was basically that in fit transplant-eligible AML patients, the combination between hypomethylating agents and venetoclax may change the classic chemo induction that is standard of care today, and it has superior disease control, the potential of more patients reaching transplant, and potentially better tolerability. It is a phase 2 study, but I believe that the results are very strong, and these results are actually pushing the field towards lower intensity venetoclax-based induction, even in fit patients.